All right, so now we're going to go to part 2, the snorkeling study you did. Can you tell us a little bit about that study?
All right, well, similar to the scuba one, I looked at 2000 to 2019, so I looked at that 20-year period, and I looked at the snorkel deaths in Australia, and there were 297, almost 300 snorkel deaths in Australia during that period.
That's still a ton, isn't it?
That's a lot.
For something that people think is a very innocuous thing, right? We let little children do it, old folks, everybody in between, but almost 300 deaths.
And there are two groups, right? There's two groups. There's predominantly surface snorkelers, which are often tourists, inexperienced snorkelers, often older people. In fact, the median age of that group was, I think, about 50-odd years old, right, of that cohort, or 47 years old. And then there was a younger group, which are breath-hold divers, usually spearfishers or, apnea divers, and their median age was about 36, 37. And they're generally fitter, but they die for different reasons.
Yeah. Can you talk about that older group? Like what were the reasons for their deaths? Was it medical? Was it getting caught in a rip? Was it aspirating a little bit of water and then having distress?
The latter, to some extent. Inexperienced divers aspirate a bit of water and get into some stress. They might go into a laryngospasm, and if there's nobody around to grab them very quickly, which is often the case, they can get into problem. Cardiac issues, as with scuba, are predominant, probably closer. Health factors were there in about 50%. Contributors thought to believe contribute to about 50% of the accident. Predominant in that is cardiac, again for the same reason as scuba.
Now, can I ask you, for both scuba and snorkeling deaths, when it's occurring due to a medical reason, are these medical risk factors known? Like, is it something that these patients could have figured out, or is it something that's what we call occult or hidden, and it's a surprise to them? Do you have a feel for what it is?
A bit of both. Look, a lot of people are on medications, so now there's a lot of hypertensives around. So a lot of hypertension's a big issue. A lot of people are being treated for that, often not terrifically successfully. That can cause left ventricular hypertrophy, enlargement of the left ventricle of the heart, which makes it more prone to an arrhythmia. And topped with that, coronary artery disease is pretty common, so they might have...
And you may be exerting yourself more than you have in years.
Exactly right. And in a situation where you've got centralised circulation and greater work for the heart, and then on top of that, aspirating a bit of salt water and getting anxiety or exhilaration. So it's a bit of a mix.
So when you say this, as a doctor, I think of a couple things. One is the importance of screening. These people going to their doctors who have some dive knowledge, or a dive doctor, and going over their meds and their risk factors. That seems obvious for anyone who's older with a medical comorbidity. But the other thing is the presence of an AED on the boat.
Yep.
So I know, the boats I've been on, just recreationally here and there, will have oxygen on board, but I don't know whether there's any laws that they must carry an AED, which to me, it sounds like you're taking older customers out, stressing them in a way that's novel and very different. You ought to have an AED.
In Queensland, the government regulations requires that boats over a certain size, dive boats or snorkel boats over a certain size, carry an AED.
Wonderful.
Now, in Australia, my organisation, the ADSF, subsidises AEDs for dive boats. So far we've subsidised, I think, over 40 AEDs around the country, and we're still opening that.
So you give money to commercial dive boats that are making profits just in order to do good and get the AED on there?
Yeah. And just because they're on there doesn't mean that's successful, though, because often,
Oh, sure, you can have non-shockable rhythms, right?
Non-shockable rhythms, and often there's delays, like in the aquatic situation, the diving and snorkelling situation. Really? Often it's 10 to 20 minutes before you've got a person landed on a platform where they can be resuscitated, where you can put the pads on. Goodness. So the likelihood of them going into a very fine VF or asystole is great. You know, but you've got an older cohort more likely to get into a primary cardiac issue, right, where AEDs might be successful if you can get them on quickly enough. So that's the key to it, and that's why we encourage it.
Wonderful. Thanks for these 5 minutes. I've appreciated it.
It's a pleasure.